Well, hello everybody and welcome. Dennis is here and this is Open Heart Surgery Survivor Series episode number 3. They don't have to be watched in the sequence. In this one, I'll be talking about the medication that I take, maintenance and monitoring. First off, Happy New Year to everybody. This is being recorded on January 8th or 9th, so reporting live from the beautiful state of Arizona, which I will show you later. But Happy New Year, stay blessed and safe. So let's talk about the medication and how I deal with it. So after open heart surgery and having the prosthetic valve in my heart, I have to take baby aspirin in the morning and the warfarin in the evening. Warfarin is also the generic name for Coumadin, and this is the blood thinner. Now, the purpose of that is the blood needs to be a little bit thinner than of the normal person, because otherwise it will get stuck to the valve and cause another clot, and then I'll have to have another emergency surgery. So, unlike normal person who has the regular blood, mine needs to be a little bit thinner. And then I have to take it for life, so every day this is something that I have to deal with. Now, in terms of the monitoring, I have to check it about every 2 weeks or every month, depending on what it does. And so the measurement for that is called PT, or prothrombin time, or INR, which is International Normalized Ratio, because PT is the timing, how fast the blood coagulates, different reagents used, and that's why INR is more of an international measurement, which is the relative. So my INR, unlike normal person, which hangs at around 1 to 1.5, mine has to be thinner, which is the higher therapeutic range between 2.5 and 3.5. I try to keep it at the level of 3, which is most optimal for me. The two things that you need to know about. The one is that everything affects warfarin, and then it is metabolized by the body. So if I stop taking it, it will just fade away. And that is why it's the food that I eat, the drinks that I drink, and then the lifestyle that I have, and everything affects it. So that's why it's constant measurement. Now, if the life is steady and stable, things are good. If it's a little rocky, well, things go a little haywire. Now, this is where it gets very interesting. Well, first of all, 2 ways to measure it: through the pinch of the finger or intravenous blood. Pinch of the finger and the stick will give me instant results. Through the blood intravenously, LabCorp or Quest Diagnostics, that will give me results in a day or day and a half. So not all the labs have the stick, so timing can be a little bit off, especially if it's done on Thursday or Friday. Won't know the results until the next week. The second thing is going for a surgery while being on the blood thinner. And this is the perfect case. In the study, right after heart surgery, I actually turned out to have another inguinal hernia, and I had to go for that. So, inguinal hernia is the outpatient procedure, and the way the surgery needs to get done while on the blood thinner is the first step is to get off of the medication, to bring that blood level to operable level, because therapeutic level is a little bit too high and it cannot be operated on. So the way it works, I get off the medication, I jump on a different medication that's called drawing blank for a second. I take heparin. If I was in the hospital, I start doing the Lovenox injections, and it's not the pill, it's not the drug. So it's something that I guess breaks up the clots without actually affecting how thin the blood is. So Lovenox is administered into the stomach like the insulin injection twice per day, left or the right side of the body. Like 1 day is good, but I've done it for about 3 weeks at one time, and it was quite painful. Get a lot of bruises, and then it's just quite nasty, but at least I get used to it. So first of all, I have to do that. Once the blood gets to the operable level, then I go for a surgery, and then I stay at the hospital until my level is back to normal. So the problem is that any outpatient surgery turns into the inpatient, because I would not be discharged out of the hospital until my INR gets to the normal level. So that's where it can get a little hairy. So my recent visit to the hospital, which had another surgery, namely the inguinal hernia, I got off the medication on like Monday, had operation about Thursday, was let go from the hospital on another Monday. So something that's easy peasy visit turns into the whole ordeal. The problem is that if it needs to be done, if it had to be done in the hospital, I would just be there for 5 days doing nothing until my blood drops to the proper level. But no insurance will cover in stay when it is the outpatient procedure. So they do it to the extent of after the surgery. That's pretty much what I do. I'm just there for 3 days until the level gets to where it is. So another thing is any kind of things that can be related to the infection, particularly I had pneumonia. So with pneumonia, I had to be in the hospital for 2 days. They wanted to make sure that nothing is serious. So while in the blood thinner, it can create a whole lot of problems that aren't necessarily visible, because any bad instance can become a lot worse. So in case of surgery, it becomes quite a procedure. In case of the blood gets too thin, dose needs to be adjusted. Blood gets too thick, INR drops low, need to add the Lovenox and then the injections, and those suckers cost about, what are they, $30 per day? Something like that. So it can get a whole lot of complicated. And then of course, the food. Now, biggest thing, and some of you probably know that vitamin K, I didn't know, but vitamin K is the one that affects coagulation of blood in the body. So this is the vitamin that contradicts the effect of warfarin. So I try to remove as much as possible foods that are super high in the vitamin K. Now, the USDA recommends 80 milligrams of vitamin K per day as the daily dosage. So most vitamins have that. And then the foods that are super high in vitamin K, and those are kale, spinach, Brussels sprouts, something else, but kale and spinach are two the biggest things. They have about 10 times the daily norm, about like 1100 or 900 milligrams. So they just have to go out. And then also leafy vegetables. Now, it's not to say that I cannot have them. I just try not to, because the life as well as the food intakes have to be very consistent. So it shouldn't go like that. It should rather go like that. So that when it comes down to monitoring. And pretty much when things are good, they are good. The basic regimen, go to the clinic, get the blood drawn, see the result, adjust the medication. Unfortunately, I was able to figure out how to level it myself more than even the doctor, because my surgeon told me you have to know your INR better than your doctor. And this is pretty much what I'm doing. So I am lucky and I don't have to do a lot of adjustments, but there were a few instances where I had to add the Lovenox injections into my stomach, and those can be quite lengthy, and then pretty much if you need them, then it's a problem. So that's about it in terms of medication. The last one, I guess, I need to mention that every time I go for the dental work, any kind of invasive dental work, I have to take amoxicillin, which is antibiotic to protect myself from any kind of possible infection. Because as you know that American Heart Association named dental procedures as one of the leading causes of infective endocarditis, as this is pretty much what I had. So to prevent it, always takes that. So few things you need to know about. I'll probably put more of the description about kind of what I talked about in the description of this video. But then warfarin for life, blood thinner for life, it's never going away. Problem too thick in the blood, problem when it is too thin, you can either develop the clot or bleed to death. And then maintenance and monitoring every 2 weeks to 4 weeks, at times every once a week. Gotta go to the doctor, do the blood and adjust medications. So on the outside it looks easy peasy, on the inside it can get quite complicated. So I hope that there's somebody you know that on medication. Show them this video, maybe they will find it helpful, educational, beneficial, or maybe it will get the peace of mind for them, because it's possible to live with it, and that's pretty much what I've been doing for the past 4.5 years. In the next one, I will actually show you a little bit of my body so you can see how so pretty much how the surgery didn't really stop me from doing what I do the best and what I love, which is exercising and living the healthy and active lifestyle. Thank you very much, and have a great night and Happy New Year.